and we are getting ourselves ready. Christmas is coming. Huh? Utapatwa tu hapa and you're not ready. Be prepared. Now listen, when we talk about looping and looping everything through your life and looking at a lifestyle, we mean very many things. We mean, for example, you are thinking of, you've for a long time thought of starting a business. You for a long time thought of getting into something new. You for a long time, but because you have so much time, sometimes you're not sure how much money you have, how you're consolidating your resources, where you shall get the extra capital from, and all those. You have not moved. Now, NCBA decided, you know what? We are in the business of making life easier for people. How about we create an app that goes beyond being an app, where you just go and interact with an app. We create an app that actually gets into your life and becomes your lifestyle. And they called it Loop. And they say, Loop makes it easier for you to think and to act. You're thinking of doing something, you can act because Loop will help you. Mm-hmm. Loop will give you all the information that you need. Loop will help you to transact right there. Loop will help you get access to loans easily. You don't have to go and queue at the bank and start saying, oh, sijui lete title ya mama yako, as long as you run an account with Loop, you qualify for a loan, and then the app can just tell you how much. It's new.
Absolutely. It's just a loop, really, what it is. That you don't have to leave the comfort of your wherever, your desk, your office, even in your vehicle. You can imagine making sure that everything is done. Yeah. Whether you're an individual who's making sure that you're paying your utility bills here and there, or you're a business where you can actually advertise your business right on this app, and everybody sees what you do. You can make your payments, you can get your things done. Really a technical way of doing things just because you download the app. How do you do that? The Google Play Store or Apple App Store. See, I got it right this time. You download it and you start to move. Download. There's some money in it for you too as well.
And then guess what happens? You're now in the loop.
Nice one, City. Nice one. City is back, as you can hear, and he's enjoyed himself in those 4 weeks, City? It's been a long time, but you just
so that you can be happy and make it 5.
Been like a month.
Yeah, it's just been a long time, but you've been chilling and enjoying yourself.
Oh, yes.
Yeah?
Yes.
All right. Our guest for the next hour is Dr. Mary Muyunzu Ayomongo, who is... She is the founder director of what many things. Mary, what is it?
Just you massacred my name.
Okay, say it.
Amuyunzu Nyamongo.
There you
Mary.
go.
Yes.
There you go. Mary Amuyunzu Nyamongo. I'm sorry, I said Ayamongo.
You said many things.
Too many things.
Too many things.
So here we go again. Our guest for the next hour is Dr. Mary Amuyunzu Nyamongo. She is the founder, director, and technical advisor at AIHD, African Institute for Health and Development. And she'll be here so we can talk about what you've been doing and your mantra, which is an Africa where people live in dignity.
Yes.
Aha. They'll tell us more about it. City is back. He has been away.
Okay.
While he was away, he was enjoying himself. One of the things that City likes to do is to read, to talk to his friends, those who are in Kenya and his relatives abroad.
And yes, relatives abroad. Oh, sorry.
Overseas.
Okay.
Even those in islands in the Lake Victoria.
They are overseas.
They're also overseas.
Oh,
So,
we know these guys.
Yes. And also, he watches a lot of content.
Okay.
One thing that he'll tell you is that all these things have been made very much easier because he has internet at home. Okay. Reliable internet at home. Courtesy of Safaricom Home Fiber. Okay. So, for example, he was watching movies. Anything for City is a movie, whether it's National Geographic movie, whether it's a series movie,
documentary,
whether it's a documentary movie. Even if he's watching football, movie. He's watching news or live from Parliament, movie.
You know, in our years when we were young, we are almost close, right? Everything was a movie.
Yeah.
We didn't have...
You called them pictures.
We called... No, movie. Cinema.
See, people are moving in it.
Movie. So Safaricom Home Fiber has made life very much easy for City.
Him.
Yeah. So he actually can take time off and not leave home.
Okay.
Because, well, he's at home. He's actually interacting with everybody that you'd have interacted with. Without having to, I am now going to travel so that I can come and spend 2 hours with you and then travel back home. No. No. Wake up, ni video link,
Okay.
like that. And that's Safaricom Home Fiber.
Okay.
Yeah? You should also consider it.
So in the islands of Lake Victoria, you are watching movie.
Believe me, on those islands, it's very strange, but connectivity is very clear.
Okay.
Very good.
Sawa.
Siti will give you the day's proverb. Every week he goes to an African country, he brings us proverbs. Now, he's going to give you a proverb from the Gambia. Your job, listen to the proverb and give us your interpretation of that proverb.
Okay.
Okay.
Was that part of the idea here?
Yeah, just part of the brief.
Okay.
He who sleeps on a borrowed mat is sleeping on a cold, very cold ground.
Okay, from an anthropological interpretation, it means if you living on borrowed time, it will not be comfortable. If you don't own what you're using, you are at risk of being embarrassed. So it can be very cold. That's an anthropological interpretation. Siti, what did the Gambians tell you? How did they interpret it for you?
Exactly the way you interpret it.
Okay. So I wore my anthropological hat. That's what I thought it meant. That if you are living on borrowed items, if what you're doing really doesn't suit you, it's time to move on to something that suits you.
Beautiful.
Yeah.
The problem is sleeping on that mat and forgetting it's borrowed.
Yes. And being comfortable.
Yes, when the owner comes for it,
Yeah.
It means all along you didn't have a mat.
And you will hit the person. That's
Yes.
how you surely. Hata angenipatia notice.
Yes. Lakini ulikuwa umeomba.
The fact, at the moment you borrowed, that was notice.
Yes.
Mary, tell us about AIHD.
Okay, so as you heard, I'm the founder director of the African Institute for Health and Development. We started this organization in 2004. I'm an anthropologist, so I did my initial studies, my first degree at the University of Nairobi. I graduated in 1989. And then I worked for KEMRI, for Kenya Medical Research Institute, for 7 years. And during that period of time, I did my PhD, SM in anthropology from the University of Cambridge in the UK. And from KEMRI, I then joined AMREF Health Africa, where I did work on reproductive health, and then moved on to Population Council, and then did 2 years with the African Population and Health Research Center based here in Nairobi. But during that time, I was burdened with the fact that we do research, but does that research really inform our programs? Are we generating evidence that is used for programs? And secondly was, are we able to inform policy, engage at the policy level with the kind of work we do? So essentially, in 2004, the burden to also just start a Kenyan institution. A lot of these NGOs are started externally, and so I decided it's time. Let me start something, an institution where we provide dignity to our people. Ill health and poverty are dehumanizing. So we talk to people about, do you understand nutrition? Your child is malnourished. And a mother tells you, yes, I know, because I can't afford food. I know what to give my child. But how do I go about getting the right ingredients to feed my child if I'm poor? In this country, as we speak, City, 15 counties are still practicing open defecation, really, in 2024. And so some of these really burden me, and I've worked a lot in the poverty space where we see a lot of diseases that are poverty diseases. Eric, if you know, we still have burdened with the intestinal worms, Mignon. There was an advert when we were younger where they were asking, Siti, uko na Mignon? Eric, uko na Mignon? Nasema, mimi siwezi kuwa na Mignon.
Je, Manduka, uko na Mignon?
Uko na Mignon? That one. And so just to recognize that you can actually eliminate manure through simple actions such as access to clean water, use of latrines. And yet, in 2024, 25 million Kenyans are at risk of intestinal worms. If you go to Western Kenya, a high population is at risk of bilharzia, which is a water-related disease. And so, as we think about poverty and as we think about dignity, we just realize that some of these conditions really require more investment in prevention, a bit of investment in and a lot of investment in education where people know what to do, but at the same time, just investments in these key infrastructural investments that really would make a difference. And so from 2004, we have, I was the executive director for the institution for 13 years. And in 2017, I stepped aside for two reasons. One, when you start an institution, the risk of you overstaying your usefulness is really high. So step aside, you assess the viability of the institution. You also bring in people with new vision. Since 2004, by 2015, your vision is beginning to get a bit old, and you just need new people, new blood in the system so that they can run the organization. But I stayed on as a technical advisor to the Institute. We do a lot of work currently in neglected tropical diseases. I talked about schistosomiasis earlier, which is bilharzia. I've talked about soil-transmitted ehrlichiosis, intestinal worms, these Muzungu names. We also work on elephantiasis, which is lymphatic filariasis, which affects mainly the coastal region. We do work on trachoma and other neglected tropical diseases. They are called neglected because, one, they affect mainly the poor and the vulnerable. And two, because access to treatment and test kits is limited because of the numbers of people affected. So over the years, Kenya as a country has committed to eliminating some of these diseases. We have leprosy, which is an old disease that we all know about. In the past, we used to have what we call African sleeping sickness, African trypanosomiasis, which is now we are eliminating as a country. Onchocerciasis, river blindness, was also endemic in the Western Belt. We are assumed to have eliminated it in 1950s through vector actions, but we're now seeking to be certified for elimination. So that's one part of what the institution does. We work with the Ministry of Health. We also work in partnership with other NGOs, including AMREF, Health Africa, Kenya Wash Alliance, and others. Another piece of work we do, which is interesting, is on non-communicable diseases. And all of us know. I think even you here, you know somebody who has cancer, diabetes, hypertension, or we are raising money for a patient. And over the last 10 years or so, we've seen a real increase in all areas of NCDs. And again, we go back to lifestyle, we go back to prevention, we go back to access to treatment. Currently, I'm the national chair of the NCD Alliance of Kenya, which is an NGO that brings together alliances and professional organizations, professionals working in NCDs. And so as a country, this is an area of need where we are seeing children with sickle cell, children with type 1 diabetes, type 2 diabetes is on the rise. And some of these are really due to lifestyle. Mental health is also another area that has, we are beginning to recognize that it's important for us to focus on mental health. Recently, there was a young doctor who committed suicide. I think when you begin to lose professionals to mental illness, then as a country, we need to sit back and ask ourselves, what are we doing to safeguard the lives of these people.
Right.
So many things. Do you have a question for me before I continue? I can continue rambling for an hour.
It's interesting that even as the work that you do are looking towards, development markers, milestones, crossing over, which is very important. But then in order to find solutions to some of these things, I think that understanding of why then is very important. I'm looking at some of the things that you talk about and some of the words that you're using: risk, poverty, health, these issues, that in 2024, there's still some problems that we have that, in my opinion, we shouldn't. Why do we still have such high levels of underdevelopment in these sectors at this stage? Why?
I think it's a question that we should all be asking. Under the MDGs, we made good progress towards attaining some of the MDGs, but we still have high deficiency of water, access to clean water. We still have deficiency with sanitation and hygiene. And I think when you think about our investments as a country, are we investing in prevention? Even at the county level, when county governments and our governors took over, even within the health sector, we saw a lot of buildings. If you go to Homa Bay, I'm sure you're aware of our western region, which I'm very familiar with. We saw a lot of construction, hospitals. We saw a lot of infrastructural investments. How much are we investing in water? How much are we investing in food and nutrition? How much are we investing in facilities that would help people be physically active, if you're looking at NCDs? So you have a lot of questions around what are we as a country investing in? Even if you go to a health facility, if I go back to the NCDs, just screening for diabetes, screening for hypertension, screening for other conditions that if they are caught early, we can actually deal with them. And then the other elements are around how we are understanding community level contexts that predispose people to some of these conditions. How are we dealing in mental health? How are we dealing with stigma? How are we dealing with making sure that people who have these conditions really get adequate care? So I think, Eric, if you look around our country, we speak, we act well, but when it comes to the actual investments in areas that would make a difference, then there is a gap.
So have you been able to establish why? Because like you said, you painted that picture very well and talked about your own research and working with the research institutions. And what was paining you was seeing the bulk of good research coming out of the communities, but then there's a huge gap between that and programs. And said, let's form this institute that then bridges this gap. But were you able to establish why there's this gap? Why is it that our research, because there's plenty.
There's plenty.
Why is it that research does not inform policy, does not inform programs?
I'm not even sure that it doesn't inform policy or programs. There's a lot of policies in this country. There's a policy on everything.
Yes.
Latif, there's a policy on pesticides. There's a policy on environment. There's a policy on cancer. There are policies on... They are really good policies. The biggest challenge we have is the link between policy and implementation. And so if, for instance, we know, we even on the Sustainable Development Goals, we have signed off them. We are talking about increasing access to water. We are talking about eliminating NTDs. We are part and parcel of that process. But if we still have deficiencies in hygiene, if we still have households that do not have access to water, if women are working 2 hours in Turkana to get to water, how much of that water is used at the domestic level? So unless we really, and we know, that's why in this country we have open defecation-free activities. Why? Because we know that if we deal with hygiene, if we resolve this issue, we'll resolve the issues of neglected tropical diseases, a lot of the waterborne diseases. And therefore, I think the gap is in implementation. And
yet,
this is, yes.
And yet,
yes,
the preventative aspect of healthcare is a lot cheaper
yes,
than the curative.
but how much do we put on prevention?
How much do we actually spend? Let's talk about a holistic look at what is spent on health, generally speaking.
Yeah.
You actually got it right. When you talk of buildings, it's not just a structure. It is where money can be expended. Okay?
Yes.
Now, buildings don't cure people. Buildings don't make people well. And if you're talking about the fundamentals of public health, you don't actually need those buildings to ensure that these things get done. The question I would ask is, for each of those huge structures that you put up in, say, the county headquarters, how many clinics that would actually meet the needs of the individuals in those far-flung places within the county could that money have put up?
Yeah, but when you bring up that issue, even within, let's even move from the structures, of the health budget, how much is allocated to prevention? So how much goes to curative and how much goes to prevention? And that's where the disconnect begins. If, for instance, 5% or goes to prevention, let's even say 15%, which is very high. The only time in this country where we had a focus on prevention was when we had the two ministers, if you remember. You had the medical...
Public health and medical services.
Yes. And then we had a lot more focus on public health. But over time, and you realize this, that even for hypertension and cancer cases, by the time people get to a facility, it's already too late. We are always told it's already too late.
Yep.
How would you capture it earlier? One is a health facility issue, but the other issue is just access to screening, educating, providing information to families. As Africans, we are also very scared of going to just to screen.
Just because what if it's there?
You go to hospital, you are well. I just want you to look at, check me
sure I'm
out,
okay.
make sure I'm okay. Especially men, they do not do that very easily. We have opportunities, especially if we have kids, to go. But just encouraging, sensitizing communities and individuals to just go for screening is something that has shown, if it's caught early, if you go into a facility and you are pre-diabetic, then you are able to prevent. Or if you go early, you are able to deal with it. But by the time we are seeking healthcare, it's too late. And even when we go to the health facility, the readiness of the health facility to support you is limited because of the infrastructural deficiencies we have in some of our facilities. So it's a whole range, continuum of missing links, gaps in the systems that continue to bedevil our health in this country.
Everybody knows.
And we know.
Right?
Yes.
Everybody who's in a decision-making position knows.
Yeah.
But then we are just unable to move. Let's take a break. We'll continue this conversation shortly at 29 minutes to 8. Our guest is Dr. Mary Amuyunzu Nyamongo.
Yes.
She's the founder director. Right. Good. I learned first.
You're a first learner.
Yeah. Founder director and technical advisor at AIHD, which is the African Institute for Health and Development. We are talking about policy formulation for poverty, health, and social protection. What do we need and how do we need to get there? Think about it as we continue this conversation. Also, think about your ease of mind. One of the things that we're talking about is, like you said, Dr. Ari, is peace of mind. Peace of mind, mental wellness.
Yes.
If you are in a position where, in a moment where you are making an emergency call and then you realize that you don't have sufficient airtime, that gives you mental anguish. And you don't want that. You're in that moment when you want to send a message, an urgent message, and then you realize you don't have sufficient airtime. That is not a good point to be. And that's why Safaricom have said, okay, let's create one all-in-one package 30 days, you pay in advance, and you're sorted for the next 30 days. Just looking at what is your consumption pattern. What they include in all-in-one is data, talk minutes, SMSs, and then they throw in free WhatsApp. Okay? So you're able to communicate with free WhatsApp. Just select your package. How do you get there, Andu?
You dial *544#. You will then see the number 4, which is Go Monthly. From there, you will then see the all-in-one plan. All-in-one packages will give you many options to choose from. There's one great one. It's 2,000 bob, and you get 1,000 minutes of talk time. CT, can you talk for 1,000 minutes?
In a month?
In a month. You can talk for 1,000 minutes.
No, you can watch movies.
1,000 minutes. 2,000.
For that, you get 17
You get 17 GB of data to watch your movies.
That's a lot of GB.
Your documentary movies, your news movies, your movie movies.
That's a lot of
In
GB.
soccer movies.
Yeah, soccer movies. And then you can send the links of those movies to your friends to watch on your free WhatsApp.
Okay.
So many things that you can do with that package.
You subscribe to that and you don't miss Kachagua's impeachment.
There you go. That movie as well.
We'll be back shortly. Keep it here.
This is the Situation Room, the only way.
Have you been searching for the perfect office space for your business? Then look no further. Standard Media Group is offering a perfect, affordable co-working space